Uh, Welcome. My name is Christina, and I'm an RVT working almost exclusively in exotic animal practice in Nova Scotia, Canada, for people who don't know me. So tonight I want to go over some clinical rounds. So I've got some journal articles that I think are pretty important with regards to vet med, exotic vet med, and a mini lecture from husbandry talk that I give. So the first journal article that I wanted to review was published pretty recently in 2021 in JEPM, the Journal of Exotic Pet Medicine, which is kind of one of the mainstays in exotic medicine. So this paper is particularly looking at the effects of metronidazole on appetite in healthy chinchillas. So metronidazole, as many of you probably know, is a nitramidazole antibiotic. It works by inhibiting nucleic acid synthesis in anaerobic bacteria and protozoans, so bacteria that grow in an oxygen-deprived environment, which often happens in places like the gut or in abscesses. And protozoans are single-celled parasites, so single-celled organisms. So things like Giardia, different flagellates, and just a few other different varied protozoal parasites that this targets. So we use this type of antibiotic particularly in chinchillas or other similar mammal species. So little hindgut fermenters. So chinchillas belong to this group of herbivores called monogastric hindgut fermenters. So they have single stomachs, and their gut has a really large blind-ended pouch between the colon and the small intestines called the cecum. So the cecum is kind of like a giant extended appendix. Not quite, but it's this big fermentation vat that's full of bacteria. So if these little guys have a cecal dysbiosis, so if there's an imbalance in that gut bacteria, we can often see pathogenic or disease-causing bacteria start to proliferate. So these gut dysbiosis cases are sometimes why we might be using metronidazole in a chinchilla patient or related species. So guinea pigs have a similar gastrointestinal physiology, rabbits, degus, so those are kind of our main hindgut fermenters that we see as companion animals in the vet hospital. So metronidazole used for these animals who may have like a cecal dysbiosis. We're using it because cecal dysbiosis can become rapidly life-threatening. What we tend to see is that healthy bacteria die off, and then we have unhealthy bacteria, or again, those pathogenic disease-causing bacteria proliferate. So sometimes there are bacteria like Clostridium that proliferate, which is an anaerobic bacteria, and we know that Clostridium spiriformis, so a specific species of Clostridium, when it dies off, it creates something called iota-like toxin, and that causes vast physiologic changes in the animal. So it's extremely toxic. It effectively causes what we call enterotoxemia. So an enteric toxin, a toxin that's coming from the gut. Tox again means toxin, and emia means in the blood, so basically like a blood poisoning. And then that can cause organ failure, so liver and kidney failure rather quickly. So when we have a cecal dysbiosis, kind of treating it promptly is really important. So we often will use drugs like metronidazole for these cases. So an issue with metronidazole, not just with chinchillas, is that it can cause what we think is probably nausea in our companion animals. We certainly see that in dogs and cats the taste is really aversive, whether it's metronidazole or metronidazole benzoate. The big difference between the two, as far as my knowledge goes, is that metronidazole benzoate is water soluble, so if we're making like suspensions, compounded suspensions, which are really common in vet med, then we tend to be using metronidazole benzoate. So we often see in other companion species that they just don't feel great, not just because we're treating them for an infection, but because the metronidazole may be causing some nausea. So kind of evaluating whether this is just anecdotal or whether this is like a real clinical effect or adverse effect that we're seeing is pretty important, because it's very possible that we're using this on sick animals and they're not eating as much because of the illness or because of other concurrent health problems or other concurrent factors. So what this study is looking at is is healthy chinchillas, so chinchillas who in theory have a normal food intake, normal poop output, so they're defecating normally. They're giving them metronidazole, which would not be therapeutic, so they're giving therapeutic doses. So here they're noting that they're giving it 20 milligrams per kilogram every 12 hours for 3 days, or every 24 hours for 5 days, which are both common protocols. We often see that metronidazole is dosed in these little guys between 20 to 30 milligrams per kilogram, and then like every 12 to every 24, it kind of depends on the reference that you're looking at. So they're using healthy animals to see, does the metronidazole alone, which is, hopefully the only variable, is going to affect their food intake. So super interesting that it did. Interesting, but not surprising, again, because we see vast anecdotal evidence, or just vast kind of clinical observations, that metronidazole does cause some upset, or does cause some nausea and reduced food intake in other species. So they did a couple different concentrations, because we definitely noticed that when we have a really high concentration of compounded metronidazole, it seems to taste really bad. So I've definitely seen, like, for example, cats, they're very, very averse to a high concentration of compounded metronidazole benzoate. So just as an example, here they're talking about 50 milligrams per milliliter and 25 milligrams per milliliter. I think the highest I've ever seen compounded was 100, that I think was meant for a dog, but then we ended up trying to use it in a cat, just because, we had extra in the clinic. We had a cat that really needed it, and we were out of the other suspension. And although, dogs definitely don't really like the taste of metronidazole, I specifically remember that this very high concentration caused a very, very nasty adverse reaction in cats. So cats tend to, they gag, they retch, they start hypersalivating. Sometimes they start to associate you approaching with the syringe or getting the medication ready with that bad taste in their mouth, and they start to hypersalivate or retch even before you come close to them with your medication. So presumably that's, creating a really, really adverse reaction to this animal to kind of elicit such a strong reaction. So we might not see the same thing with our little prey animal species like chinchillas, because they tend to be pretty stoic, although definitely chinchillas, if they like the taste of a medication, they absolutely will get really excited when you're getting the medication ready, and they kind of grab the syringe and bring it to their mouth, and sometimes they try to steal the syringe from you if it tastes good. So we tend to see they get really excited for that, but I don't always appreciate that they're having these adverse reactions when there is something, or an adverse kind of expectation when there is something that tastes bad if they know it's coming. So so back to the study. So they tried a few different dosing regimens. So again, the 20 milligrams per kilogram every 12 hours for 3 days, or every 24 for 5 days. And those are not uncommon dosing protocols if we're looking at a pet who we're worried about acetyl dysbiosis and enterotoxemia. And they tried a couple different concentrations to see, again, is there a difference between the high concentration medication, which would be a smaller volume because it's more concentrated, but presumably would taste worse, versus the lower concentration compounded medication, which in theory would probably taste not as bad. Maybe your masking agent, whatever flavoring you have in that, is a little bit more kind of overwhelming to the taste of it, but then the volume's a bit bigger. So same dose overall for these trials, I guess, but just different concentrations. So they found that no matter what the concentration or the dosing protocol, food intake is significantly reduced within 24 hours of drug administration, regardless of formulation type, compounding protocol, or drug concentration. So it is real. We do see a food intake reduction with metronidazole in chinchillas, and then presumably in our other little mammal species too. Because again, they have very similar gastrointestinal physiology, and while it's really important not to kind of extrapolate too far, so not to kind of take a conclusion from this study and say, well, this applies to all of these species. We can probably guess that if we were to repeat this type of experiment in rabbits and guinea pigs, we'd probably have pretty similar results. But again, we can sometimes be surprised. Sometimes these types of studies, we have something that kind of confirms our bias, so we're kind of expecting that it's probably going to affect food intake in these animals. So then it's just confirming our bias. Although this was a randomized blinded crossover, so technically the people given the medications would not have known what they were giving to the animal, so they would have probably been giving like just the compounding agent without the medication. Which is definitely going to be detailed further down here. When I was reading this before, they gave Orlin, which is a really common compounding suspension, and so they wouldn't have known what they were giving, which is really important because, again, we all have biases, we all have expectations, and we want our experiments to be bias-free. So the study conclusions just kind of reinforce that we have to be really careful with using this drug in chinchillas and, again, presumably our other high-net fermenters, and monitor food intake really carefully. So from a nursing perspective, what we're doing if these patients are in hospital or if I'm consulting with a client about using this medication at home if they're an outpatient, is that we really need to pay very close attention to food intake as well as fecal output, because these little animals, again, they are very, very reliant on that gut working properly. So food, including lots of fiber, goes in, then poop comes out, and if poop is not coming out, then their gut is very unhappy, and then we can have all these other horrible things happen, like that stasis and all the other sequelae of that, including acetyl dysbiosis, if that wasn't already happening. So again, from a nursing perspective, we're making sure these animals are eating and pooping. I usually consult with clients and talk to them about monitoring the size of stools and shape of stools. So chinchillas have little, like, kind of pill-shaped stools, so we're making sure that those are not looking to breed or round or smaller and drier or less frequent. And chinchillas tend to specifically take in most of their food at night, so it's a really good habit for pet owners to kind of take a look at their chinchilla cage first thing in the morning and see, what did my pet eat overnight, what did they poop overnight, because during the day, while they do eat and poop, they're not eating or producing as much stool compared to their nighttime activity period, because they're naturally pretty nocturnal or crepuscular. So in a hospital, if you don't have a 24-hour facility, this can be really challenging. For patients in hospital, I'm monitoring pellet intake, and I'm monitoring hay intake as well as fecal output. We chart these things to make sure. Sometimes what we'll do is take photos of their stools throughout the day to kind of monitor progression, especially if we have case handover to different staff or we've got multiple staff monitoring the patient. Sometimes people will use like those little pill organizers and put poops in throughout the day to kind of monitor how the patient's stools are progressing throughout the day, especially if we're seeing that, we have very stasis-y, small and happy stools, and then we want to see those progress better. And of course, if patients aren't eating enough and they aren't pooping enough, regardless of whatever medication we have them on, then typically we're adding in supplemental nutrition. So products like Oxbow Critical Care, products like Emerade IC Herbivore, or whatever their longer-term herbivore. Emerade Sustain Herbivore, is their other product. So those are kind of the two big brands that I tend to use in clinic. I find that Oxbow goes over really well with most chinchillas, particularly the fine grind papaya flavor. So we're adding that supplemental source of calories and fiber to get that gut happy and moving again. So all that to say, the study kind of confirms something that we really suspected, but doing the science is really important. So it's always good to see that.